A report from the Detroit Area Agency on Aging reveals alarming statistics about mortality rates for older people in the Detroit area. The report is called Dying Before Their Time, and it analyzes data collected over a 19-year period in Detroit and 8 neighboring cities. The research shows that the death rate for residents aged 60 to 74 is 48% higher than the rest of Michigan. And for people aged 50 to 59, they're dying at a rate 122% higher than other areas in the state. I talked with the agency CEO, Ronald Taylor, about the reasons behind the disproportionate death rates and what can be done to change the numbers. Ronald Taylor, welcome to American Black Journal.
Well, thank you so much for having me, Stephen.
I found this report really interesting and not in a good way, right? The numbers in the report are just harrowing. I want to start our conversation there. These are gaps that I think most people are not aware of, number one, but that point to incredible danger for people of color and African Americans in particular, and older African Americans especially. Just spend some time talking through what you found here.
Yeah, this is the third edition or the third iteration of the Dying Before Their Times report that was initially completed in 2002 by the Detroit Area Agency on Aging. And when that report was initially commissioned, one of the things in which we were curious about, and I had to give my predecessor, Paul Bridgewater, a great deal of credit for having the foresight to commission such a report, but we were concerned about the outmigration of the population. And what we found in the study of the report was very startling. And the fact that our population had excess mortality rates, which were 2 to 2.5 times greater than their cohorts during the rest of the state of Michigan. And and as you stated, Stephen, it is troubling that after 19 years of longitudinal data, that we're still seeing that some of the same trends are in place as related to, we have folks that are 50 to 59 that are passing away at much, much greater rates than their counterparts in the rest of the state. And then also the number of individuals that are dealing with what we call chronic illnesses, and especially dealing with 3 or more chronic illnesses. We're talking about close to 40% of our senior population. That is very startling and is very troubling.
Yeah. Talk about some of the risk factors that help produce these numbers. What is it that we're dealing with here?
Yeah, I would say some of the risk factors is there's a buzzword out in the industry now and what we call social determinants of health. And the social determinants of health essentially take a look at those conditions or those factors that can influence the health outcomes of an individual or community. And so when you take a look as far as the education or the food availability or access to health care, also you take a look at as far as the opportunities for employment, environmental concerns. Those are all factors that impact. Folks generally say that you could tell by a person's zip code what their health outcomes will be. And those are some of the factors that go into that consideration.
Right now, of course, we're dealing with a once of a century, perhaps, kind of health crisis that, of course, makes everything more urgent and makes everything more critical. Talk about the effect of the pandemic on these numbers that you're seeing in this longitudinal survey.
Yeah, I think the COVID-19 or this pandemic in which we're dealing with has really pulled the scab off the wound in many ways, or has really placed a magnifying glass on the conditions of those communities of color, and especially within the African American community. And I say that because we're dealing with a community in many ways that are dealing with its own pandemic as related to the health disparities or the chronic illnesses in which folks are dealing with. And when you layer that on top of what I would say would be some systemic issues that our community has faced, it truly has magnified all the various injustices and disparities in which, unfortunately, we're still having to deal with today.
Yeah, yeah. And of course, the response to George Floyd's murder, the highlight on systemic racism, the
Mhm.
Black Lives Matter movement really brings into focus some of these things that you're talking about. The fact that if you are born Black in this country, if you are over the age of 50 in this country, it just looks different. Everything you're dealing with is sort of processed through the lens of bias and racism, and that has consequences for the people who are part of those communities. For us.
That's correct. That's correct. You know, I've been thinking about as related to my own upbringing and some of the things in which my grandmother, who was born in Mississippi, and just some of her concerns and fears, and then also some of the stories in which she shared about the opportunity to receive healthcare services and how it really wasn't there, and how they had to really travel around to get those services. And you know, you take a look as far as growing up and becoming a little older, as far as a teen, and you see some of your not parents, but your loved ones, aunts and uncles and others, and they're passing away at early ages, and whether it's because of hypertension or diabetes or whatever that condition may be like. And we come in and we're at this particular point in stage, and the fact that we're still dealing with these issues at that same level as when I was a child, it's kind of alarming, and it seems like it's a face is being placed upon these chronic illnesses, and recognition is there that that the social determinants of health and has an impact on the chronic conditions in which our community faces, but the gap in regards to addressing these issues are still great.
Yeah, yeah. I mean, again, those numbers just blow your mind when you
Yeah.
how dramatic they are. I want to spend the rest of the time talking about solutions and things we ought to be really focused on as ways to move the needle, both in the short term and then, of course, as you point out, longitudinally, right, across time, how we get to close that gap with other communities.
Yeah, there's a number, I think, as you indicated, short-term and long-term action steps that will probably have to be pursued. And I believe the first step, and is one in which this community and other places throughout the country have tried before, but we have to continue to take a swing at the bat as related to addressing it. But we have to collectively come together as a community, and we have to collectively come together across industries and across sectors to really come up with solutions to improve our availability of food, to improve the access to health care, to improve the employment opportunities, to improve the environmental factors, to improve the just the various factors that enhance the quality of life. And that's going to be a collective and collaborative effort. But one thing in which I will say, Stephen, is I also believe it has to be an intentional effort. And it has to be intentional in the fact that it has to be a priority and something that is addressed on a continuous basis. So that's one of the aspects. And so that would entail that we would have to improve the stock as far as healthcare professionals within the community and access to care. But some of the things also in which we're taking a look at is that we also need to provide activities and services and awareness type of programs that addresses the lifespan. It really does us no good to try to address the chronic illness when a person returns 50 or 60. Yeah. We need to be looking downstream in the lifespan and raising awareness to our youth and to our young adults as related to these are some of the preventative things that can take place or that you should be adapting to have an enhanced quality of life. The second part of it is that we're taking a look in, or what we're proposing is that we really need to provide additional supports and resources to caregivers. And the reason in which, and also grandparents raising grandchildren. And the reason in which we say that we need to provide those supports to our caregivers is because informal caregiving, it is the backbone of our healthcare system. And we need to provide those supports to those individuals that are really providing services and the supports to individuals dealing with chronic illnesses. The third aspect of things is that we really believe that funding, more funding needs to be allotted to what we call human community-based services. And essentially what that entails is that we can probably address more service or more lives by providing services in the community. And the other aspect of that equation, though, Stephen, is that we need to get the resources to those community-based organizations that people of color will probably trust and probably respond to as related to addressing their needs. And then the fourth aspect that I would say really needs to be taken a look at is that most of our allocation methodologies from a federal and a state perspective, they're provided based upon population and some other factors. The factor of need really needs to be brought into the discussion and brought into the equation when allocating resources from the federal and state level.